Hi, this is Dr. Ward, and I wanted to review some post-op instructions for denture delivery. This is one of the biggest adjustments to anything that we do in dentistry is to take someone who has all their teeth, some of their teeth, take those out, and now we're going to have a piece of acrylic that we're going to try and chew and eat on, have some retention, stay in your mouth, and it just takes time. So one of the first things that we talk about is just when it's first delivered, there's going to be some sore spots, some areas where there may be the acrylics touching a little bit too hard on some bony edges, or the tissue's just real thin. The pressure points from just pushing on it, maybe the borders are overextended and we need adjustments on that. So in general, we will deliver the denture, and then typically we're gonna see you 48 hours to 1 week for your first post-op. What we will do at that point is those areas where you've worn the denture, we'll be able to see those in your mouth, and we will make the adjustments. It just takes perseverance and it takes patience. You are learning to kind of manipulate your lips around the acrylic borders, the flanges that are on the denture. The speaking space is less, so how do I work with the thickness that's inside my mouth? And that just takes time. Saying judge, church, 60, 61, 62, and just work on those things out loud will help you transition. But it is definitely one of the most challenging things. Just know that with time it gets a little bit better, but at the end of the day, it's still a piece of plastic that you're putting in your mouth trying to chew with. Most of the time we try to help transition people out of a denture into at least implants that help retain the denture, or maybe we can replace us with implants that hold your teeth in permanently that don't come in and out. So there's some options for you, but once the delivery of a removable appliance is always challenging. So know that there's some written instructions that you have to go over. In general, chewing with dentures, don't overcommit to what you're trying to eat. The tissue takes time to kind of callus underneath it. So it's not used to having all these pressures on it. So you really, for the first week to 10 days, you're on not liquid, but very, very soft diet. And then over time, we'll go a little bit harder and a little bit harder till eventually you try to eat as much as you can, as much as your denture will allow without dislodging. So there are lots of things that are just common sense with dentures, but just don't overdo it. The other thing is just cleaning them. Make sure you brush them just like you do your teeth. Toothbrush, toothpaste, brush them all. You can soak them in a denture cleaner once a week, Polident or brand of choice, whatever that is. But just make sure that you're cleaning them well. Make sure you take them out for at least 6 hours a day. You want oxygen to get to the tissue to keep the gum tissue healthy. So generally at night, you sleep at least that long. So just to take them out at night, that's a good time to do that. If there's any other questions, there's some written instructions that you have for that. And obviously we're here for you anytime. Thanks.